A year ago this week, the World Health Organization, WHO, declared COVID-19 a pandemic. Since the first case of infection with this new coronavirus was reported in China in December 2019, SARS-CoV-2, as we now know it to be called, has killed over 2.5 million people and infected at least 116 million. Beginning as an unexplained, pneumonia-like illness, first detected in China's Wuhan province, it has since spread to almost every country, bringing life across most of the world to a near standstill for the last year. World leaders became ill, entire countries were locked down to prevent the spread of infection, and international travel ceased. As most governments struggled to contain the virus, scientists were rushing to identify and find treatments that worked against COVID-19. As infections surged worldwide, new, highly transmissible variants of the virus were identified and are circulating ever further. With many vaccines now approved, over 300 million doses have been administered, and over 65 million people are now fully vaccinated. But this represents less than 1% of the world's population, and while the vaccine offers a glimmer of hope for a return to normal, there is still a long way to go. As countries, including the UK, are preparing to lift restrictions, we look back at a year that changed the world forever.
We know that the disease is caused by the SARS-CoV-2 virus, which spreads between people in several different ways. The virus can spread from an infected person's mouth or nose in small liquid particles when they cough, sneeze, speak, sing or breathe. These particles range from larger respiratory droplets to smaller aerosols. Current evidence suggests that the virus spreads mainly between people who are in close contact with each other, typically within 1 meter. A person can be infected when aerosols or droplets containing the virus are inhaled or come directly into contact with the eyes, nose, or mouth. The virus can also spread in poorly ventilated and/or crowded indoor settings, where people tend to spend longer periods of time. This is because aerosols remain suspended in the air or travel farther than 1 meter. People may also become infected by touching surfaces that have been contaminated by the virus when touching their eyes, nose or mouth without cleaning their hands. Whether or not they have symptoms, infected people can be contagious and the virus can spread from them to other people. Laboratory data suggests that infected people appear to be most infectious just before they develop symptoms, namely 2 days before they develop symptoms, and early in their illness. People who develop severe disease can be infectious for longer. While someone who never develops symptoms can pass the virus to others, it is still not clear how frequently this occurs and more research is needed in this area. Both terms refer to people who do not have symptoms. The difference is that asymptomatic refers to people who are infected but never develop any symptoms, while pre-symptomatic refers to infected people who have not yet developed symptoms but go on to develop symptoms later. There are many things you can do to keep yourself and your loved ones safe from COVID-19. Know your risks to lower risks. Follow these basic precautions, follow local guidance, check to see what national, regional and local authorities are advising so you have the most relevant information for where you are. Keep your distance, stay at least 1 meter away from others, even if they don't appear to be sick, since people can have the virus without having symptoms. Wear a mask, wear a well-fitting 3-layer mask, especially when you can't physically distance, or if you're indoors. Clean your hands before putting on and taking off a mask. Avoid crowded places, poorly ventilated, indoor locations and avoid prolonged contact with others. Spend more time outdoors than indoors. Ventilation is important. Open windows when indoors to increase the amount of outdoor air. Avoid touching surfaces, especially in public settings or health facilities, in case people infected with COVID-19 have touched them. Clean surfaces regularly with standard disinfectants. Frequently clean your hands with soap and water, or an alcohol-based hand rub. If you can, carry alcohol-based rub with you and use it often. Cover your coughs and sneezes with a bent elbow or tissue, throwing used tissues into a closed bin right away. Then wash your hands or use an alcohol-based hand rub. Get vaccinated. When it's your turn, get vaccinated. Follow local guidance and recommendations about vaccination.